Hi, I'm Amanda Langseeder, and welcome to Sullivan 180 Presents Take 5. Our guests today are Karen Holden and Janna Walter from Sullivan County Public Health Services. Welcome, Janna and Karen, and thank you so much for being here.
Hi, good morning, Amanda. Thank you for having us. My name is Karen Holden. I'm fortunate to work here at Public Health, overseeing our home health agency, epidemiology, and working with Janna and the Drug Task Force in our newly formed pillar, which we call CARES, which is all about focusing on moms.
And I am Janna Walter. I am maternal child health and CPS public health nurse. I work directly with families in our community to ensure safety, health, well-being, and I also work directly with the Drug Task Force CARES pillar.
Wonderful. Thank you again for being here. And would you mind explaining a little bit about medication-assisted treatment? What exactly is MAT?
Sure. We're going to talk about a few acronyms. So according to SAMHSA, which is the Substance Abuse and Mental Health Services Administration, medication-assisted treatment, which is called MAT, M-A-T, is a combination of the use of medications along with counseling and behavioral therapies. So we provide a whole approach to the treatment of substance use disorders. The medications used in this treatment are always approved by the FDA, the Food and Drug Administration, and MAT programs are clinically driven and tailored specifically to meet each patient's individual needs.
And research shows us that a combination of medication and therapy can successfully treat substance use disorders. So people that are struggling with addiction, or for people who are struggling with addiction, MAT can help sustain the recovery, and MAT is also used to prevent opioid overdose. So MAT is primarily used for the treatment of addiction to opioids such as heroin, prescription pain relievers that contain opiates, and it's a prescribed medication that operates to normalize the brain chemistry, and it kind of blocks the euphoric effects of alcohol and opioids. So it helps to relieve psychological cravings, it normalizes body function, and you don't have that negative effect of the euphoric feeling of other substances.
That's great. I'm so glad that we're talking about this and taking down the stigma and just talking openly about the benefits of MAT. What was the need for this very specific list of MAT providers that treat pregnant women, women of childbearing age, and how was the list created? How is it going to help us?
So, as many people are aware, Sullivan County is very challenged with an increased number of drug overdoses, sadly. And it's the objective of the Sullivan County Task Force to obviously save lives and just decrease the number of deaths associated with drug use. So the best way to do so is exactly what you just said, break down that stigma. And that stigma that's associated with drug use, and then also to provide services to those who are trying to seek help. So that being said, when trying to make a referral for MAT treatment, our staff had difficulty trying to locate facilities and providers within the surrounding areas. And we thought, if it's so difficult for us who are not in crisis to try to find help for our patients, how difficult must it be for someone who is in crisis, who really wants that help, but is also battling, I might be having that craving right now. And you know what, the frustration of digging through the internet, it was terribly frustrating for me, and I wasn't in crisis. So I can't imagine what it's like for our friends and families out there that are struggling with substance use disorder.
And the concept, as Janna mentioned, is to make this comprehensive list very easy and accessible for everyone who needs it. We all know that crises don't generally happen Monday through Friday, 9 to 5, and so this is going to be posted throughout county websites and easily accessible and at people's fingertips, so when they need our help, we are easily reachable.
That's great. What can community members do to help with this issue, continue breaking down the stigma around substance use disorder? What would be your call to action for the community to help right now?
So I would venture to say, and I hope what I'm saying is accurate, I think it is, that every family has been affected by addiction in some way. So nothing is solved, not an illness, not mental health disorders, and nothing is solved by pointing a finger, calling names, being judgmental, by shaming. So my advice is to research, become educated with evidence-based practices, ask questions. we at Public Health, we're here to answer questions all the time. So if you are someone or know of someone who is struggling with substance use and you need advice, you can call us directly at Public Health. You can call our Hope line. That's a Hope Information and Referral line, and that number is 1-866-832-5575. And we're here to help.
Right. We need everyone to remember that no one is alone, and everyone has been affected. We can get through this together.
Absolutely.
Absolutely. You know, on International Overdose Awareness Day, I think we saw a lot of the families being able to finally come into an open space and share that they were struggling with the loss of a family member or a family member who's battling addiction. So truly, it's just so important that we talk about this, continue to break down the stigma, and encourage our community members to help everyone do that as well. Is there anything else that you want to add?
Yes, I wanted to say, in addition to that, you just said community members again. If you're watching this and you're a partner, you're a friend, you're just someone who's going through something or has a family member, share all this information. Share it on your social media, share it with your friends, share how to reach out to us. We're doing our best to get information out there, but word of mouth is hugely important. Right. And just my own personal plug for the program that I specifically work with and for, and am so passionate about, is that if you are someone who is using drugs and you're pregnant or thinking about becoming pregnant, and you need help, please call us. Call that Hope line. I'll mention the number again, 1-866-832-5575. Call us at Public Health. Go on the website, Sullivan County website. Numbers are all there. I don't want to throw all these numbers at you. And because we have this home visiting nurse program through Maternal Child Health, and it's a non-judgmental program. I'm here to provide support, to provide referrals, and I keep saying this over and over again. I just want to wrap my arms around everybody and give them the support and love that they need to be successful.
Absolutely.
You said it earlier, Janna, there's no shame. There is no shame when somebody comes to you. And I know that. I've seen that. I've seen the work of your program and how it interacts with members of the community that are just struggling and just need help where they're at. You're there, and we're so grateful that all of Public Health has been there for our community nonstop. And of course, certainly during this last year and a half. So thank you for joining us today, Janna and Karen. Your work in our county is so very valued and so needed. Thank you both for working to make Sullivan County a healthier place, 1 degree at a time.
Thank you so much.
Thanks. Our pleasure.
Thanks for having us.
Yeah.